911 Global Meds Disclaimer. This video and any contents herein are posted on this YouTube channel of 911 Globe Meds for informational and educational purposes only. Please see the detailed video contents disclaimer and the copyright disclaimer in the text section below.
Hi and welcome to our telehealth video information series. I'm Garvin and this video is on Neulasta. So Neulasta, or Pegfilgrastim, is a colony stimulating factor, a man-made form of a protein that stimulates the growth of white blood cells and is used to decrease the incidence of infection by treating neutropenia, or a lack of certain white blood cells caused by receiving cancer chemotherapy. So Neulasta is for reducing the duration of low white blood cell counts, or neutropenia, and risk of infection in people treated with chemotherapy for cancer, with the exception of chronic myeloid leukemia and myelodysplastic syndromes. So how does it work? Neulasta injection contains the active ingredient Pegfilgrastim, which is a type of a medicine called a recombinant human granulocyte colony stimulating factor, or GCSF for short. So GCSF is a substance produced naturally by the body that stimulates the bone marrow to produce white blood cells, known as neutrophils. Filgrastim is a man-made version of GCSF. Pegfilgrastim is a pegylated form of filgrastim, which means it is attached to a substance called a polyethylene glycol. This increases the length of time that the filgrastim works for. So neutrophils, like all blood cells, are produced naturally by bone marrow. They play a central role in the body's immune system because they help defend the body from infections. A low level of neutrophils in the blood, or neutropenia, leaves a person very susceptible to life-threatening infections. Neutropenia can be caused by a number of factors, including cancer chemotherapy, which often kills normal healthy cells as well as blood cells, as well as the cancer cells. Filgrastim is used to stimulate the bone marrow to produce neutrophils and thus correct low neutrophil levels in the blood. This reduces the duration and severity of neutropenia caused by cancer or chemotherapy. As a result, filgrastim minimizes the need for antibiotic treatment, the risk of complications due to infections, and length of time spent in hospitals. Neulasta is given once every cycle of chemotherapy. It is given as an injection under the skin or subcutaneously, approximately 24 hours after chemotherapy. Neulasta should be stored in a fridge at 2 to 8 degrees when not in use. You will need to have regular blood tests to monitor the numbers of blood cells in your blood while you're receiving treatment with Neulasta. Neulasta should be used with caution in acute myeloid leukemia, people who have recently had pneumonia, sickle cell disease, and also Neulasta is not to be used if you have an allergy to filgrastim or E. coli derived proteins, chronic myeloid leukemia, myelodysplastic syndromes, secondary acute myeloid leukemia, breastfeeding. This medicine is not recommended for children and adolescents under 18 years of age, and this medicine should not be used if you're allergic to one or any of its ingredients. So tell your doctor, your consultant or pharmacist if you've previously experienced an allergy. So for pregnancy or breastfeeding, the safety of this medicine during pregnancy has not been established. It should not be used during pregnancy unless considered essential by a doctor. And for breastfeeding, there is no information available about the safety of this medicine during breastfeeding. For this reason, it should not be given to women who are breastfeeding. If this relates to you, for further advice, speak to your doctor. So the side effects of Neulasta: pain in the bones or muscles, chest pain, injection site pain, headache, enlargement of the spleen, and nausea. Also, you can get allergic reactions such as anaphylaxis, blistering skin rash, difficulty breathing, swelling of the face, lips, throat and tongue, fluid in the lungs, pneumonia, a sudden inability to breathe, respiratory distress, and decrease in the number of platelets in the blood. Abnormally high numbers of white blood cells in the blood also. So the side effects I've just mentioned does not include all the side effects reported by the manufacturer for this medicine. For more, you need to read the patient information leaflet or talk to your doctor or consultant for more on the side effects. How can this medicine affect other medicines? So this medicine should be administered approximately 24 hours after chemotherapy for cancer. If it is given before this, the chemotherapy medicine may also affect any new blood cells produced by the filgrastim. That brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through our website, mytelehealth.info, or call into us at Lynch's Pharmacy, Douglas, Cork. Or you can ring us 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.